it up a little bit. And the intent is, of course, just that you kind of move this thing to some part of the joint that doesn't have any entrapment. And there are plenty of these recesses in the hip joint. I mean, they can stay gone for a long, long period of time. Trouble with these things, unless there is a small flake of bone attached to them, of course, they are radiotranslucent, so they never show up. And it's the history, just this twinge that disappears. Yes, Steve. I don't find very many.
I get it every once in a while, and I hear a lot of people, I mean, for one reason or another, a lot of times they're unrelated to what I'm seeing people for. They get a stitch in the hip, and it bothers them for one day, and it's gone, and then it's nip the capsule.
Could well be. It may be lots of reasons. You know, half the time it's unsatisfactory, as I say, in terms of finding anything. You'd think that a nipped synovium might produce a sort of a mild synovitis, which might show up as a mild capsular pattern, of an acuter type. These true loose bodies tend to be just in between the articular surfaces rather than irritating the capsule particularly. But I certainly think that because we can never see them, it's totally speculative as what causes these things. But this protocol is not a bad protocol for this kind. I mean, it's not particularly threatening. It's well worthwhile trying. If it doesn't help, you've really lost nothing. If it works wonderfully, if it works well, then you're a miracle worker. You know, and that's nice to be sometimes.
Would a loose body be painful on a normal hip joint? I guess you wouldn't have a loose body in a normal joint, but if you had...
Oh, yeah.
Would they ever complain of just being locked without being painful? Could a loose body not cause pain if it was...
I've never had anybody with just a locking, and even, you know, with my own cartilage in my knee, when it was locked, it was, well, I don't know about painful, it was very uncomfortable. The question really is, we could ask ourselves, what causes the pain between the joint surfaces with this? When there are no kind of pain receptors, is this something on the deep surface of the periosteum below the articular surfaces? You know, I mean, people always just say with cartilages and things, you know, you shouldn't be able to feel pain. Mine was quite painful. And I knew exactly what I'd done without having the knowledge from the so-called absence of nerves there. I knew that I'd torn that.
Cartilage is really, really soft.
Yes, yeah.
So if you have a loose body, it could press on the subchondral bone. And that's definitely painful.
Lewitt, that's a good point that Chris has brought up. Lewitt did some experimental work, and actually I think his conclusions were probably a little erroneous. That when he talked about having a loose body of, or perhaps a meniscoid within the joint, he used to sort of describe this meniscoid as having got trapped in the joint, and because the hyaline surface we think about as being very hard, but he sort of proved that it wasn't. He sort of said that it used to give you an impression within the hyaline cartilage of this little fragment, and this thing could stay within the surfaces because it kind of like had dug in, and that it was on a tag that pulled on the capsule, and this is what caused the problem. The only thing is that when you look at most of the people, say in the spine, they hold the joint open. They don't hold it kind of like in the position you'd think that was the least stressful. To open it, you'd think, would be not too bad, because perhaps this thing could get pulled out. So it didn't really follow, and I think the meniscoid theory that's been propounded by Bogduk and Gwenjul is probably a more plausible explanation. But he did prove by just taking a hair and putting a ball bearing or something, just a little bit of pressure on the hair, that you could see the impression of the hair on the hyaline cartilage just by gentle pressure on the hair. It did imprint the hyaline cartilage. So this business of it's very, very hard, you know, almost like enamel or whatever, it's not like that at all. It's very slippery, particularly when it's lubricated, but you can get sort of indentations in it with these loose bodies. But what exactly the pain pattern is from these, that's a bit more elusive, and it may be something to do with stimulating of the subchondral bone, which of course is innervated. So these are sort of theories. So if you can remember that what we're doing, the key for this is, first of all, sort of the pattern of these twinges and the absence of other signs, then can you sort of do the weight bearing and see if there's some range that's not too bad and some range that is. If there's one that is, stick away from that. But essentially it'll be which rotation is more comfortable, and then we will go from flexion to extension and we'll go into the pain-free range, and then we'll test it, pain-free range, probably test it, and then if that's not worked we'll come into the painful range, but just starting to just encroach upon that range, and as you see, get more confident that you're not hurting the patient with the traction, then we sort of increase the oscillation of the movement. So maestros, let's see how you do.